Well, hello there, and welcome to a very special deep dive. You know that moment, maybe catching a glimpse in the mirror or running a hand through your hair and noticing something subtly shifted.
Mm.
A little less volume, perhaps,
Mhm.
maybe a widening part, or just, more strands than usual left in your brush.
Yeah, it's a really common frustration, isn't it? It touches millions of us worldwide.
It really does. We're talking about hair loss, obviously.
Yeah.
That uninvited guest that often arrives quietly before becoming, well, kind of hard to ignore.
Exactly. And for such a long time, the paths to addressing it have felt like, well, either a bit like guesswork from ancient times or really quite invasive and expensive modern options.
Right.
But what if the key to waking up those dormant hair follicles wasn't actually in a bottle of chemicals or, under a surgeon's knife? What if it was in something as gentle and natural as light itself?
Okay, now here's where things get really interesting, I think. Today, we're taking a deep dive into a non-invasive breakthrough that's quite literally turning heads. Red light therapy for hair regrowth.
Hmm.
Imagine, like, giving your scalp a gentle, invigorating sunbeam, a kind of energy boost for those hair plants that just need a little nudge to sprout and thrive again.
Yeah, that's a great way to put it. Our mission today is really to illuminate everything, from understanding the subtle mechanics of why hair loss happens in the first place,
Okay.
to peeling back the layers of how this light therapy actually works. It's profound magic at a cellular level.
So we'll cover the science.
Oh, yes. We'll journey through the science, we'll trace its sort of unexpected history, look at the real-world results, and even tackle some of those persistent myths that are out there.
Perfect. We want to cut through the noise for you, give you that shortcut to being, really well informed, and maybe even inspire a fresh perspective on how you can approach one of life's most common cosmetic challenges. So let's get started.
Let's do it.
So it's no secret that hair loss is widespread. We know that. By age 50, something like half of men will experience male pattern baldness,
That's right.
and up to 40% of women face thinning by menopause. But it feels like more than just a cosmetic concern, doesn't it?
Oh, absolutely. For many people, it feels like a signal that something deeper might be a little off balance.
Okay.
What's really foundational to understand here is that each hair on your head, it goes through this distinct, quite intricate cycle. There's growth, then a resting phase, and then shedding.
The hair cycle.
Exactly. In a healthy scalp, about 90%, the vast majority of your hundreds of thousands of follicles are actively in that growth phase at any one time.
90%. Wow.
Yeah. So when that delicate rhythm gets disrupted, that's when we start to notice the thinning or the loss.
So what are the main things disrupting that rhythm? What are the primary culprits?
Well, the most common one by far is androgenetic alopecia.
Right, which people know as male or female pattern baldness.
Precisely. For men, it often kicks off with that receding hairline or thinning on the crown, and it's largely driven by a hormone called dihydrotestosterone, or DHT.
DHT, I've heard of that. It shrinks the follicles.
It literally miniaturizes them over time, yeah. For women, it typically shows up more as a widening part line or just a more general thinning across the scalp. And it's often influenced by significant hormonal shifts like pregnancy or, as you mentioned, menopause.
Okay, so genetics and hormones are big players. But it's not just about that, right? It feels like the story is often more complex.
Absolutely. It often is. We also see conditions like telogen effluvium.
Telogen effluvium.
Yeah, that's where significant stress, and that could be from an illness, maybe drastic dietary changes, even profound emotional upheaval. It basically pushes too many hairs into the shedding phase all at once.
So a sudden shedding event.
Exactly. Then there's also alopecia areata. That's an autoimmune condition where the body mistakenly attacks its own hair follicles, leading to patchy baldness.
Right.
And we can't forget external factors either. Things like harsh chemicals in some hair treatments or hairstyles that put constant tension on the roots.
Like tight ponytails.
Yeah, traction alopecia, or even some medical treatments like chemotherapy, obviously.
So if someone is experiencing this, this thinning or loss, how does understanding these underlying reasons actually help them?
Well, think of your hair as a surprisingly accurate barometer for your overall health.
Oh, interesting.
Things like nutrient deficiencies, low iron, maybe biotin or protein, they can literally starve the follicles of what they need to thrive.
Okay.
Underlying conditions too, like thyroid imbalances or PCOS, polycystic ovary syndrome, they can throw hormones wildly out of whack.
Right.
Even something as simple as poor circulation in the scalp, like a clogged highway, it prevents vital oxygen and nutrients from reaching the hair roots. All these factors contribute to thinning that can really dent one's confidence. So knowing the whys is the crucial first step to finding a path forward.
It really makes sense. And, humans have been looking for solutions forever. Our ancestors were pretty creative, weren't they?
Yeah, they certainly were.
I mean, we've come a long way from, say, Egyptians slathering castor oil and hippopotamus fat on their heads.
Believe it or not, yes.
Or even the Romans apparently trying pigeon droppings.
Indeed. The ingenuity was definitely there, even if the scientific rigor was perhaps a little less so.
Just a bit.
But fast forward to modern medicine, and we certainly have more effective, scientifically backed options now, but they often come with their own set of considerations.
Okay, so could you walk us through some of those more conventional, modern solutions that people might be familiar with?
Certainly. So we have topical minoxidil, which is widely known as Rogaine.
Right.
It works by widening blood vessels, essentially boosting nutrient flow to the follicles. It's generally accessible, often around, say, $30 a month, and it's effective for about 60% of users, which is pretty good.
But there's a catch.
The catch is you have to use it indefinitely. If you stop, the benefits tend to fade away.
Ah, okay.
Then for men, there's oral finasteride or Propecia. That effectively blocks DHT production, which is great, but it does carry potential side effects for some, including reduced libido.
Right, that's a concern.
And for women, sometimes spironolactone is used. It can help by taming hormones, but it requires careful monitoring by a doctor.
So those are sort of the daily application types?
Sure.
What about the more intensive, maybe clinical procedures?
Yes, good point. There's platelet-rich plasma, or PRP injections.
Yeah.
That uses your own blood's growth factors to stimulate dormant follicles. Each session can cost between, say, $500 and $1,000. And you typically need multiple sessions.
Okay, so that adds up.
It can. Then you have hair transplants. That involves surgically moving follicles from denser areas to the balding spots. These can range anywhere from $4,000 up to $15,000 or even more.
Wow.
And they're quite invasive, obviously, with notable downtime needed for recovery.
And microneedling, I hear about that too.
Yes, microneedling is another method. Tiny pricks are made in the scalp, aiming to stimulate the body's natural repair process. It's also often used to enhance the absorption of topical treatments like minoxidil.
So these methods, they certainly work for many people, but as you say, they can be costly, sometimes involve pain, or demand this lifelong commitment.
Exactly.
Which makes the idea of a gentle, non-invasive alternative incredibly compelling, doesn't it?
It really does.
So how does this red light therapy we're focusing on actually work at a fundamental level? How does it avoid those pitfalls?
Okay, so at its core, red light therapy is about harnessing very specific wavelengths of light. We're primarily talking about red light, typically in the 615-80 nanometer range.
Okay.
And also near infrared light, which is slightly longer, from about 810 to 850 nanometers.
And crucially, it's not like UV light.
No, absolutely not. Unlike UV light that causes tanning or sunburn, this particular light is very low energy. It's non-thermal, meaning it doesn't produce heat, and it's considered quite safe for daily use.
So definitely not baking our scalp. That's good to know.
Definitely not.
But how does this light actually, work its magic inside our cells to promote hair growth? What's happening?
Okay, picture your cells as tiny batteries.
Right.
What's truly fascinating here is that red light essentially charges these batteries. It does this by specifically targeting the mitochondria.
The powerhouses of the cell.
Exactly, the powerhouses within our cells. This light gets absorbed by a really crucial enzyme in the mitochondria. It's called cytochrome C oxidase.
Cytochrome C oxidase.
Think of it like a master switch. When red light activates it, it basically kickstarts the cell's energy production into overdrive.
So it dramatically boosts the production of ATP.
Adenosine triphosphate, yes, ATP, which is effectively the energy currency that fuels all cellular growth and repair.
So it's like giving the cells a direct energy infusion.
Precisely. For your hair follicles, this translates directly to waking up those dormant ones, helping to extend the active growth phase, the anagen phase, and also reducing inflammation around the hair roots, which can often choke off growth.
And it can even trigger helpful signals.
Yeah, in controlled amounts, it generates specific reactive oxygen species. Now, don't let the name scare you. In this context, think of them not as damaging agents, but as important internal messengers. Yeah, they signal your cells to grow, to repair, and to regenerate. It's kind of like giving your scalp a gentle, invigorating caffeine shot, but completely without any jitters.
That cellular caffeine shot analogy really clarifies it. It's not about zapping them, but just providing the exact energy they need.
That's a perfect way to think about it.
And what do these devices actually look like for someone thinking about trying this at home or in a clinic?
Well, they range quite a bit. You can find simple handheld combs all the way up to full coverage helmets or caps that you wear.
Okay.
The light penetrates the scalp, importantly, without heat or harm. In a clinic setting, you might see larger panels or dome-like structures. While for home use, these devices make it incredibly convenient. You can often use them while you're doing other things like watching TV or reading.
So clinics might use focused lasers, but home devices use LEDs. Is one better?
That's a good question. Clinics might use lasers for very deep targeted treatment in some cases, but the broader, more diffuse light from LEDs in helmets and caps is actually very effective at covering a larger scalp area efficiently. Ah,
So many studies show comparable results, and the LEDs make the home devices really practical and convenient for that consistent daily or near daily use, which is key.
right, consistency. So what's the typical routine like?
Sessions usually last somewhere between 10 to 20 minutes,
Okay.
and you do it maybe 3 to 5 times a week.
Mm.
Patience, though, is absolutely essential.
Right, not overnight results.
Definitely not. You might even notice a temporary increase in shedding initially.
Really? Why is that?
Well, it's thought that the older, weaker hairs are pushed out to make way for the new, stronger ones that are being stimulated.
Hmm.
So it can actually be a good sign, counterintuitively.
Interesting. Okay, so when do people generally start seeing results?
Typically, you'd start seeing noticeable thickening and perhaps reduced shedding within about 3 to 6 months of consistent use.
3 to 6 months. Okay, that's manageable. Now we've got the how it works at the cellular level, which is fascinating. But for listeners who might still be a bit skeptical,
What's the most compelling evidence that it truly works? What does the actual science say?
right, the proof. Well, the scientific term for this whole process is photobiomodulation.
Photobiomodulation. Got it.
Basically, how light influences biological processes. And the research, honestly, paints a very promising picture.
Like what? Any specific studies?
Yeah, absolutely. For instance, there was a 2014 trial focusing on men. It showed an impressive 39% increase in hair count after just 16 weeks of low-level light therapy.
39% in 16 weeks. That's significant.
It really is. Another study back in 2013 reported significantly more hairs in the groups treated with light compared to the control groups who used a sham device.
Okay.
And just recently, a 2024 review specifically looked at women experiencing androgenetic alopecia, and it highlighted significant gains in hair density for them too.
Wow. And even for chemotherapy-induced hair loss.
Yes, we're even seeing studies showing light therapy can help speed up the recovery process after chemo. The data is quite robust now, confirming its efficacy. It's definitely not just, wishful thinking or a scam.
That's genuinely remarkable. But does the type of light or how it's delivered truly make a difference? You mentioned wavelengths.
Yes, absolutely. Wavelength matters quite a bit. For stimulating things closer to the surface, red light around that 650 nanometer mark is excellent.
Okay.
Whereas near-infrared light, being a longer wavelength, dives a bit deeper, which might be beneficial for more stubborn cases or reaching follicles deeper down.
And it's not just lasers. LEDs are effective too.
Correct. It's important to remember it's not exclusively about lasers. LEDs, while they produce less focused light, are highly effective in these broad coverage devices like helmets and caps. Numerous studies have shown comparable results between LED and laser devices for hair growth. And large reviews, meta-analyses of randomized trials have consistently confirmed statistically significant improvements in hair counts across the board.
Okay, that's very clear. But this leads to a key question. Is red light therapy suitable for everyone experiencing hair loss?
That's a crucial point. It's generally most effective for early to moderate stages of hair loss. That's when the follicles are still alive, but they've become sluggish or miniaturized.
So they need that energy boost.
Exactly. If someone has progressed to, say, a total baldness in an area, or if there's significant scarring on the scalp where follicles have been destroyed, unfortunately, a light therapy can't resurrect what's no longer physically there.
Right, it can't create new follicles from scratch.
No, think of it more as prevention, slowing down loss, and revitalizing weakened follicles rather than outright resurrection.
Got it. Revitalization, not resurrection.
Right.
That's a good distinction. And you mentioned earlier, this isn't some brand new, untested idea. Light's healing powers actually have a pretty fascinating and sometimes accidental history, don't they?
Oh, indeed they do. It stretches back further than many people realize. We saw ancient Egyptians experimenting with sunlight for various skin conditions. Then, much later in 1903, Niels Finsen actually won a Nobel Prize for his groundbreaking work using UV light to treat skin tuberculosis, lupus vulgaris.
A Nobel Prize for light therapy.
Yes, but specifically for hair, the story takes a really unexpected turn in 1967.
Okay.
There was a Hungarian scientist named Andrei Mester. He was actually doing experiments with newly developed lasers on mice, trying to see if they posed any cancer risks.
So a safety study.
Exactly. And quite by accident, he noticed that in the areas where he'd shaved the mice's fur and exposed them to a low-level laser, the hair grew back significantly faster than in the unexposed areas.
Wow, complete serendipity. A true aha
Yeah.
moment from an unrelated experiment.
Absolutely. And that accidental observation wasn't just a random fluke, was it? It had bigger implications.
How so?
Well, it profoundly demonstrated that low-level light energy could actually stimulate biological processes without causing heat or damage. This challenged a lot of conventional thinking at the time. It really opened the door to exploring non-invasive treatments using light for conditions previously thought untreatable by such, well, gentle means.
So that discovery paved the way.
It did. By the 1990s, this low-level light therapy, or LLLT as it became known, was being actively explored for things like wound healing and pain relief.
Okay.
Then, the big step for hair came in 2007. The FDA cleared the very first laser comb device specifically for treating male pattern baldness.
2007. Okay. And for women?
That clearance was extended to women in 2011. And today, of course, we have all sorts of LED helmets and caps joining the mix, making the therapy much more accessible for people to use conveniently at home.
That's a fascinating history. So, okay, bringing it back to today, for those of us who might still harbor a healthy dose of skepticism,
Understandable.
what does the more recent real-world data and maybe expert advice tell us about its effectiveness now with all these devices available?
Right. Well, a comprehensive review in 2021 looked at 15 different studies. It confirmed that LLLT does stimulate hair growth in both men and women. And significantly, larger trials demonstrated actual increases in terminal hair, the thicker, pigmented hairs, not just fine fuzz.
Okay, that's important. Terminal hair.
Yes. And another study in 2024, this one using 675 nanometer LEDs, noted significant efficacy even in what they called recalcitrant alopecia,
Meaning?
meaning cases that were proving difficult to treat with other methods. So it showed promise even in tougher situations.
That's incredibly encouraging. And what about combining therapies? You mentioned earlier that might be beneficial. Is there an advantage to a multi-pronged approach?
Yes, definitely. If we connect this to the bigger picture of maximizing efficacy, that 2024 trial I mentioned actually showed significant synergistic effects when red light therapy was combined with minoxidil.
Synergistic, so better together than either one alone.
Exactly. The combination helped turn those thinner, intermediate hairs into thick, robust terminal hairs more effectively than minoxidil by itself.
Okay.
And real-world feedback seems to echo this. You hear reports from clinics, for instance, like Zennara in Hyderabad you mentioned in the outline, where specialists report patients with androgenetic alopecia seeing reduced shedding within months when combining therapies. As one leading dermatologist put it, it's like energizing the follicles' batteries, prolonging growth, and improving overall scalp health. Consistency, especially when potentially combined with other approaches, really seems to pay off.
That makes sense. So for someone considering this, what are the main choices available? Should they definitely go to a clinic, or are the home devices a solid option?
Good question. Professional sessions, like those offered at specialized clinics, they use medical-grade panels or lasers, often offering very precise application. Typically, you'd go maybe 3 to 5 times a week for those 10 to 20-minute sessions.
And the cost for that?
Those courses can be quite an investment, ranging anywhere from, say, $1,000 up to maybe $3,000 or even more, depending on the clinic and the duration.
Right. And the home devices?
Well, for convenience and accessibility, home devices have really democratized access. You've got FDA-cleared options like the iRestore helmets, maybe costing around $500 to $700,
Oh, yeah.
or current body helmets, perhaps $700 to $1,000. There are also bands like the Hairax bands starting around $200 or so. These deliver similar effective wavelengths. They're generally considered highly effective, especially for mild to moderate cases, and they are incredibly easy to just incorporate into your daily routine at home.
Much more convenient. How do dermatologists generally view this therapy now? Is it part of their standard toolkit?
It's increasingly becoming so. Dermatologists really emphasize getting a thorough evaluation first because, as many specialists confirm, hair loss has deep roots, genetics, stress, hormones, all the things we talked about.
Right. Find the cause first.
Exactly. They validate that red light therapy works via that mitochondrial boost, enhancing ATP and blood flow, so they see it as an ideal option for common pattern baldness or even things like temporary postpartum shedding.
And do they recommend combining it?
Often, yes. They might recommend combining it with other treatments like minoxidil or perhaps PRP for those synergistic effects we discussed. But importantly, they always stress that it's definitely not an overnight cure. You have to manage expectations. Expect to wait those 4 to 6 months for visible changes.
Okay. Are there any situations where someone shouldn't use red light therapy? Any contraindications?
Yes, there are a few standard precautions. If you happen to be taking certain medications that increase sensitivity to light photosensitive drugs,
Right.
or if you have certain conditions like epilepsy, or if you're pregnant, it's always best practice to consult with your doctor before starting, just to be safe.
ACEs.
But otherwise, for most people, it's considered very safe with a low-risk profile.
All right, let's switch gears slightly and clear the air. Let's bust some common myths that might be floating around about red light therapy.
Good idea.
First one, the idea of instant results, that you'll put the helmet on and see dramatic changes overnight.
That's a definite myth. As we've hammered home, you need months of consistent, dedicated use to see those significant changes. Our bodies simply don't operate on an instant gratification timeline, especially with hair growth.
Okay, myth busted.
Mhm.
Number two, that it can regrow hair from completely bald spots where maybe there's no follicle left at all.
Also a myth. As we discussed, it needs live, albeit potentially sluggish or miniaturized follicles to work on.
Hmm.
It's all about revitalization, providing energy. It's not resurrection from absolutely nothing. The energy needs a target to reactivate.
Right, revitalization, not resurrection. Got it. What about the fear some people might have that it could cause unwanted facial hair growth?
That's not true either. The specific wavelengths and the delivery methods are designed to target and penetrate the scalp effectively. They don't stimulate hair growth elsewhere. The robust data consistently supports its efficacy for scalp hair without that particular side effect.
Good to know. And beyond myths, what about actual safety? Are there any significant side effects people should genuinely be aware of?
Very rarely, some individuals might experience some mild temporary redness on the scalp immediately after a session, or maybe that initial brief shedding phase we talked about.
Sure.
But these typically resolve very quickly as the scalp adjusts. The FDA, having cleared many of these devices, has rigorously reviewed the data and confirmed there are no known risks of burns or other long-term adverse effects when used as directed.
That's reassuring. We touched on power pairs earlier, combining therapies. Let's circle back just quickly. How can someone really maximize their results if they decide to try red light?
Yeah, maximizing results. Well, as we saw, combining red light therapy with something like topical minoxidil or even potentially microneedling has been shown in studies to outperform solo therapies.
So the synergy is real.
The synergy appears to be real, yes.
Mhm.
One study demonstrated this quite clearly. And also, don't forget the inside-out support.
Nah, like diet.
Exactly. Making dietary tweaks, ensuring you're getting enough key nutrients like zinc, iron, omega-3 fatty acids, maybe biotin, and managing stress levels. These all provide a strong foundational environment for healthy hair to flourish alongside the light therapy.
Right. It's holistic. It's clearly gaining traction, too, even in the public eye, isn't it?
It seems to be.
We've seen mentions of celebrities like Jada Pinkett Smith using red light for her alopecia areata, Lily Reinhart sharing her routine on social media, even former NFL star Wes Welker endorsing some of the caps.
Yeah.
It really is becoming a more visible, discreet, and seemingly effective solution for quite a few people.
It is. And when you consider the investment again, clinic courses might run $1,000 to $5,000 potentially,
Right.
whereas home devices are often a one-time cost, maybe $200 up to $1,000 or so. For many people, especially when you compare that to the potential long-term cost or the invasiveness of transplants or ongoing drug costs, it represents pretty significant value.
Yeah, that makes a lot of sense from a cost-benefit perspective, too.
Yeah.
Looking ahead, then, what do you foresee for the future of follicle fixes and red light therapy specifically? Where is this heading?
Well, advances are already happening quite rapidly. We're seeing development of dual wavelength devices using both red and near-infrared light simultaneously, potentially promising even better results through optimized penetration at different depths.
Okay, smarter devices.
Exactly. We're also seeing more portable designs, even app-linked devices emerging, which could make the therapy even more integrated and personalized into daily life, tracking usage and maybe progress. With more ongoing trials and just growing acceptance within the medical community and among consumers, I think red light therapy could very well become a standard first-line defense against hair loss for many people, really moving from being seen as alternative to firmly mainstream.
That's a really exciting potential future. So there you have it. That was our deep dive into red light therapy for hair regrowth. It feels clear that, experiencing hair loss doesn't have to feel like an inevitable life sentence anymore.
Got it all.
This therapy really does offer a genuine beacon of hope. It's safe, it's backed by increasingly robust science, and it seems surprisingly simple to integrate into your life.
Absolutely. And whether you're exploring options in a specialized clinic somewhere like Hyderabad, or maybe just using a cap or helmet in the comfort of your own living room, it's really about potentially changing your personal story, doesn't it?
Yeah.
One targeted beam of light at a time.
Yeah.
It feels like it's about empowerment through illumination in a way.
I like that. Empowerment through illumination. And I think my biggest takeaway for you, the listener, from this deep dive is that consistency truly is your best friend here.
Absolutely key.
Consult with a professional if you can. Commit to the routine, whichever path you choose, and you might just find your confidence regrowing right alongside your hair.
Well said. And maybe that leaves us with an important question, something for you to mull over. In a world that's often seeking complex, sometimes aggressive, high-tech interventions for everything, how might a simple, gentle energy like red light actually be the most profound path to revitalization? Not just for your hair, but perhaps for your overall sense of well-being and self-assurance, too.
Something to definitely think about. Until next time, keep digging, keep learning, and let there be light.